Welcome back inside Mountain News this morning. Today, Dr. Joe Kingery from UK Healthcare is with us. Thanks for joining us.
Thanks for having me.
This morning we're talking about ear infections in children. So what are some things that cause ear infections?
Sure, so good question. Typically what we think of with ear infections are two main types. There's the middle ear infection, which is behind the eardrum, and then there's also the ear canal itself, which is what we commonly call swimmer's ear. Swimmer's ear, otitis externa, which is in the ear canal, it's usually caused by bacteria that gets in there and kind of grows, causes pain and discomfort, can occur after swimming, of course, and hence the name, but can also occur anytime there's moisture buildup in the ear canal for a while. So taking a shower, not getting the ear fully dried out, that type of stuff, and also diabetics are prone to that. But behind the eardrum, the middle ear infection that people typically get and little kids will have a lot of is something that we face. And it's usually caused by one of two things, a bacteria or a virus. And used to the misconception was that anytime you've got an ear infection, it's a bacteria, you got to have antibiotics, you got to go get it treated. And that's not always the case because it can be caused by a virus and antibiotics are not going to help. But at the same time, we like to see children especially for that because we want to take a look and see, is it behind the eardrum, is it in the ear canal, does it need ear drops itself to treat the ear canal, or do you need antibiotics, or just kind of a watch and wait and give it some time thing.
Well, how can a parent tell the difference between the two? What are some things that they should be looking for?
Sure. It's tough to tell the difference between the two. Typically what happens is children obviously may not complain about specifically I have ear pain, but they may be tugging at their ear, especially when they're really little and infants, and they'll be tugging at their ear, and you think, well, what's going on? And you notice that they keep on doing that over and over again. That can be the only sign sometimes that they have an ear infection. Other things you look for is a fever that goes along with it, especially if it's a bacterial infection. Fever is common. The other thing too is that sometimes that you actually have drainage from the ear, either from behind the eardrum that's actually popped open and ruptured, or from the ear canal itself. So either way, the symptoms are going to be similar in children especially, and getting to the provider and getting it checked out is probably the only way to truly know what's going on.
What if a parent is starting to see some of these behaviors? What are some things they can do maybe before they take that step and going to the doctor?
Good point. So a lot of times the tugging at the ear is actually pain, even though the kid may not be complaining of pain. It's still bothering them, so things like Tylenol can definitely help with the pain itself to be able to ease the discomfort. The other thing, children over the age of 6 months can have Motrin as well, or ibuprofen, and that can help with the fever and pain as well. Especially if they're having fever, I'd recommend go ahead and try Tylenol or ibuprofen if they're over 6 months old. But also at the same time, it's probably a good idea to go ahead and get it checked out, because if the eardrum does rupture, it does affect their hearing later in life especially. So it's a good idea to get it checked out and see if you actually need treatment for it or not.
It's not quite swimming season yet, but can children wear earplugs, or is there anything they can do to prevent ear infections?
So it's a very good question, actually. So like you said, it's not swimmer time yet, but kids play in bathtubs, they play in the shower, they're going to get water in their ear. And some people's ear canal is just made a little bit different, more narrow. It traps water easier than others, but regardless, certainly you can get an infection in there. And things you can do to prevent it, obviously when you give your kid a bath or shower, try to dry it out the best you can with just a towel around the ear. If kids are prone to getting swimmer's ear over and over again, obviously earplugs is an option. Even in shower or bathtub, you could wear it just to help protect and keep the water out. The other is sometimes we'll actually tell people to, if you know that there's nothing else going on, you can use some alcohol drops in the ear just to dry out the moisture really good and keep it from recurring. But I'd only do that if the provider says, yeah, you need to start doing this.
Sure. All right. Thank you, Dr. Kingery.
You're very welcome. Thank you.
We'll have more Mountain News in just a moment.